Today we are talking about your choppers. That's right, it goes beyond having shiny teeth, but good oral health involves total body wellness as well. Research shows that failure to care for your teeth can cause illness, low self-esteem, learning challenges even. So for the next half hour, Dr. Malik Johnson with Eric J. Sadler, DDS and Associates is here answering all of your oral health questions. What we want you to do is we want you to be able to talk to the doctor directly. So text your question right now. The number is at the bottom of your screen. You see it there, 336-379-5775, and we're going to get your question to him. All right, so Dr. Johnson, let's just first start off with what is the top dental concern in kids and in adults, and is it the same thing?
The top dental concern, is it the same thing? Yeah, I would say it's the same thing. The number one chronic disease in children is actually dental caries or cavities. So cavities is the most prevalent childhood disease. So I would say that's the number one kind of concern. I think as we get a little older, we start getting more concerned with things like aesthetics and how do I look? How do people look at me? So that kind of starts to be, at least personally, an overwhelming um, kind of concern. But the most consistent thing we deal with is dental cavities. Like you said, it starts with children. Number one kind of chronic disease. So every child needs to be, seeing the dentist regularly.
Okay, and then let me just ask, when do you actually start seeing the dentist?
So we're taught, and we tell people when you get your first pair of teeth, is when you need to start thinking about it. But realistically, around that first birthday, you wanna have your child come see a dentist. You wanna have them begin to be comfortable seeing the dentist. If they come to see us early on, and we're able to build a rapport with them, familiarity. There's less crying, and more good work that gets to be done. So around that first birthday, definitely before the second birthday, go ahead and come in and start getting routine dental appointments.
And what do you do like around the first or second birthday with kids at the dentist's office? Because I'm like, you can't clean their teeth, so what do you do?
Yeah, it's a lot of fun. Typically, we get a crying baby, and mostly we just want to, count the teeth, see that they're having teeth, see how many are in there, make sure the ones that are in there that look okay, they're not growing in awkward angles or anything like that. A common thing early on is bottle caries, actually. So when you're putting a child to bed and things like that, and you leave them with a bottle of milk or juice or whatever it may be, but mostly milk, and it sits on those teeth overnight or while it sleeps. So if you're watching this, make sure you take that bottle when your little baby goes to sleep, because that's something we see and we check for a lot. So at that first visit, we're just trying to kind of get acquainted with the child, with the baby. They're going to cry most times. We're going to count the teeth. We're not trying to hurt them. A lot of times at first visits, we're not taking X-rays yet. We're literally just kind of getting acquainted, checking out, making sure everything looks at least as regular as it can at that age.
All right, so that's for babies. Let's talk about like adults and maybe even older children. Maybe people haven't been to the dentist in a couple of years and maybe things have changed a little bit. What do dentists do and check for in a routine dental visit?
Yeah, so routine visits typically consist of X-rays and a good intraoral exam, right? Around when those permanent teeth start to come in, even before we start taking X-rays, but definitely around 6 years old, when most children start to have those permanent teeth come in, is when we begin taking X-rays and really looking, because now we're dealing with permanent teeth, obviously. So around that age, it's critical to start coming in regularly, at least yearly, to get a set of X-rays, a set of bite wings to check those things out. Then as you get around age 12, age 13, we start taking two sets of bite wings, right? Because you get an extra set of teeth. So around age 12, you should start getting your second molar, which is one of the last teeth that you get. So around then we start getting really adult type of exams now, because you should have most of your adult teeth. So twice a year, you want to come see your dentist. You want to get an exam, intraoral exam, right? In that exam, we're not only doing X-rays, but we're checking for oral cancer, signs of oral cancer and disease-like processes like that. We're checking for gum disease and periodontal disease. We're making sure like your jaws function well. When you're in that teenage age, it's critical to start kind of considering things like braces, orthodontics, and things like that to make sure everything's lining up. So definitely, want to get two exams a year. One of those is going to typically include X-rays, and the older you get, you might need to start coming in more, if you need the deep cleanings, if you're having pain and things like that. And typically an exam is going to consist at least of an intraoral examination and a set of x-rays.
And a set of x-rays. So don't be, put off like when they say it's time for your x-rays, because that was coming at least once a year. All right. We've got a couple of questions already. Someone was asking, does vaping affect your oral care?
Vaping.
Yes.
So vaping is still considered pretty new as far as research and things like that are going forth. They're going to have more kind of information about that as we go on. But at the end of the day, you are putting, smoke. Sometimes things say metal is in those vaping instruments, as well as tobacco or whatever it is that you're vaping. So anytime you're introducing things like that into your body, it's not going to be a positive thing. And anytime you have any type of smoke or any type of carcinogen or whatever it is that you're vaping, it's not going to be positive. Any type of smoke and things like that is going to be harmful to the tissues in the mouth. It's going to dry out your mouth. A dry mouth is a catalyst to dental cavities. So I would definitely recommend laying off the vape.
Okay. Laying off of it. Okay, we're going to take a quick break. We're going to be back with more of your questions coming in just a few minutes.